Medicare. As I understand it, in a November 2010 proposal in which you did some work with Congressman Paul Ryan, that there was a recommendation in that proposal that we raise the Medicare eligibility age incrementally by 2 months per year to the age of 67. And I wanted to get your views. One of the concerns I have is that as we look at where the rising health care costs, where entitlement spending is going, we need to make some responsible decisions in ways that protect those programs around here to make sure that they are preserved for those that are relying on it, particularly with the recent Medicare trustees report that came out saying that essentially it goes belly up in 2024. Wanted to get your view whether you think that we should still gradually raise the retirement age, what other thoughts you have for reforming Medicare to make it more sustainable for future generations.
The work that I did with Congressman Ryan focused on seeing, we never had a completed proposal, but seeing if we could get a bipartisan proposal on premium support. And I had forgotten that he had raising the age in there. That wasn't part of what he and I were working on. But I do believe that a version of premium support, particularly the one that I worked out with Senator Domenici and our task force, which is actually different from what Ryan was talking about. Anyway, I think that's a very good approach to the future control of costs in Medicare. Raising the age possible over a long period doesn't save a lot of money because those young seniors between 65 and 67 are not terribly expensive. It's people my age that are more expensive. And most of them are not working and don't have coverage. So you might then transfer those costs to the exchanges under the Affordable Care Act as they get set up. But that's not an advantage to the federal government. So I'm a little skeptical of raising the age, although it certainly ought to be in the mix of things considered.
Do you believe we fundamentally need to reform what we're doing with respect to Medicare
Yes.
In order to preserve it?
I do. And I think there are several fundamental reforms possible, but the one that I have come out in favor of, and which is a very bipartisan idea, is a version of premium support.
Do you think we can get there to preserve Medicare just through provider cuts?
No.
Does anyone else want to comment on that on the panel?
Dr. Rivlin is exactly right. In fact, we are providing cut Medicare right out of existence, where people, when they're my age and they start to think about where you might retire to, you have to start thinking about whether or not, if you move, your doctor is going to see you. Doctor availability is a serious issue in this country because we keep pushing these provider cuts. We are killing a program we need with provider cuts. We have to start shifting the structure of the program to make it affordable in a manner, I think, essentially what Dr. Rivlin was describing.
Okay. I appreciate